afternoon and for joining the Superior Health Quality Alliance Roundtable conversation. Today we are our topic today is how one nursing home is boosting COVID-19 vaccination rates. My name is Kim Heft, and I am joined by my colleagues, Kelsey Ostergren and Jerry Hinneker, as well as our special guest speaker today is Sue Brown. She's the Director of Nursing at Medalodge in Rochester Hills, Michigan. For those of you that have been joining these meetings over the past few weeks, welcome back. Those who are new to the call, we're glad to have you here. We host this session each week with a 30-minute education session where we highlight important topics related to COVID-19 vaccinations and boosters. We hope you'll be able to join us each week. One thing I would ask is that you think about any pebbles in your shoe, things that keep you up at night or that you're struggling with or trying to figure out. If you can send me a direct message in the Zoom chat, we may be able to add this as a topic for a future session. There will be a survey at the end of the session, which we encourage you to complete. This is very helpful for us determining future topics and speakers. There will be no slides, though, for today's event to share. We really just have a few questions to ask our speaker today, and there are no resources to be shared at this time. Please use the chat box to share any comments, questions, or anything else that pops into your mind during the presentation, and we will use that for discussion with any time that we have remaining. With that, I'm just going to turn this over to Kelsey for an important update.
Awesome. Thanks, Kim, and good afternoon, everyone. So for those of you who've been joining these calls over the past few weeks, you might recall a session we had a few weeks ago on motivational interviewing. And so we were joined by another Superior Health staff, Mia Croyle, who spoke about kind of how to use these motivational interviewing strategies as part of your conversations with staff and residents alike for vaccines and boosters. So in follow-up to that, we are planning sort of a part 2 motivational interviewing session, which will actually be 2 weeks from today. So it'll be April 6th. And our goal for this session is really to make it interactive and provide you with some real life practical examples of how you might be able to take some of the questions or comments that you're receiving from staff and kind of flip the script in how those conversations are going and use some of those motivational interviewing strategies. So all of that to say, we need your help. If there are comments or questions or things that your staff are raising to you as you're trying to have some of these conversations, let us know. Because what we're hoping to do is use those and do some like role play and just sort of have fun with it. But we want it to be meaningful. So if you can tell us what those kind of common questions are or concerns that you're hearing from staff, that would be super helpful. So either you can throw it in the chat box now, or you can email them directly to Jerry, and we'll put her email address in the chat box too. So if you think of things later, let us know. Again, it's 2 weeks from today, so we've got a little bit of time, but at least just wanted to plug that so you guys know that's coming up. And again, would love to be able to use some of your real life examples in those kind of sample scenarios we go through at that point. So open to all of your feedback. Please let us know. And with that, Kim, I will turn it back to you.
Okay, thank you, Kelsey. All right, so we're going to take off here with our objectives. Sue first is going to give us an overview of the vaccination process for Medalodge, Rochester Hills. Then we're going to discuss barriers and strategies Rochester Hills has implemented to increase COVID-19 vaccination rates. And lastly, we're going to gain an understanding of how workplace culture influences vaccination efforts. With that, again, I welcome Sue Brown, Director of Nursing at Medalodge, Rochester Hills. We welcome you, Sue. We're so happy that you're here. If you could just start out, Sue, and share with us a little bit about yourself and the nursing home that you're representing today.
Sure, thank you very much. Yeah, my name is Sue Brown. Suzanne Brown is my formal name, but since we use that to indicate that the state is in the building, I don't usually go by Suzanne very often anymore. So Sue is fine. I graduated from nursing school in 1979, so I've actually been a nurse this year for 43 years. The first part of my nursing career, I worked at the DMC at Harper Hospital. And then after I had my children, when I came back to nursing 20 years ago, I started working in long-term care. I was at Medalodge of Rochester Hills for 14 years, and now I have been at Medalodge of Rochester Hills since then, with a little bit of a stint at Medalodge of Bloomfield Hills, which is no longer there. So I've had both acute care hospital experience and then, of course, long-term care experience. We don't really have any kind of a silver bullet for our vaccination process. I mean, what we have done is probably what a lot of you have done, but with new admits or readmits, we start off by obtaining their MICR, which is the Michigan Registry for Immunization. So in Michigan, that's kind of nice to have. And we offer the vaccine once every 2 to 4 weeks at the facility. So if we get a resident who needs to have a vaccine, then we'll have it available for their next dose or their booster. And same with the staff. We also have that available that often for them. We encourage them to complete their series and get the boosters as soon as possible, and we include that in all of our care conferences or any kind of communication that we have with the responsible parties and with the resident. The residents who refuse, we offer again with each vaccine clinic. We call the guardian or we ask the resident. Sometimes seems like we're hitting a brick wall every time, but other times maybe something else has come up with the resident's health and they really change their mind that they really would like to have the other vaccine. So it does work, and every once in a while we'll get somebody that we can get fully vaccinated or up to date with their vaccines. With new hires for staff, we do require an exemption prior to them performing any resident care. And then, of course, they have to wear the required PPE for staff who are unvaccinated. And so we also highly encourage them to get the vaccination because that means they can cut back a little bit on that PPE and maybe not have to be wearing that N95 every single day in the whole building, at least. And so we do highly encourage them to complete their vaccinations also. And we do a POC test on those unvaccinated staff 1 to 2 times a week, depending on the community transmission rate. So they do also have to be tested more frequently, which is also sometimes a good reason for them to be vaccinated because they don't necessarily like to be having that nasal swab every twice a week sometimes. The strategies that we found most successful has really been, the biggest one is to use informal leadership in our building to encourage the unvaccinated staff to become vaccinated. Every building has a formal leadership, which is your regular chain of command, starting with the administrator and the DON and working its way down to all the staff. But there's always an informal leadership also, people in your building who have influence over other staff members. And if you can get them on board with becoming vaccinated or becoming boosted, you'll be able to have them get some other people on board that are within their informal circle. And so people that live near each other, people that are within a certain cultural group, they can be people who hired in together that are kind of a group of people that kind of get to know each other because they went to orientation together, they were new to the building together, et cetera. And sometimes I've had staff that have refused to be vaccinated, but once they've talked to their peer group, have decided to go ahead and get the vaccine because they see their friends or their colleagues who they know and who they trust getting the vaccine. We also did one thing where we offered the vaccine to friends and family members of the staff if we had extra doses at the end of the vaccine clinic. Because I'm sure you all know that the vaccine comes in a certain number of doses per vial, and you don't want to waste the vaccine, especially at the beginning of the vaccination programs. They wanted to make sure that every dose was used. So we would have them call their family members, their friends, if there was somebody who needed a vaccine, and they could come in and get vaccinated. So that also encouraged other people to become vaccinated. To increase the rates among the residents, it's really just a matter of constant education and constantly explaining to them and their family members how highly transmissible COVID is, and how it can quickly lead to very uncomfortable and sometimes deadly symptoms for residents. And many times you get the same question over and over and over, and it's just a matter of being very patient and realizing that part of what you say is going to go in one ear and out the other with the residents and the family members. And when people are first admitted, they have a ton of information that they're presented with. You know, they're figuring out, should they sell their mother's house and car, and what's going to happen down the road with their mother. And so the thing about the vaccination may not be at the top of their list. So with every time you have any kind of communication with the resident or family member, you want to bring it up again, because the vaccines, eventually they might say, oh, you know, yeah, that's right, we were thinking about that. And sometimes it's just a matter of bringing it up more times with them. We also bring up the fact that we've really had a low rate of side effects from the vaccine that we've given to our residents. Our residents, other than a sore arm, have had very few side effects. And I think that's something they also are very concerned about. But if they understand that we've been giving this vaccine now for a while, and we haven't had a big problem with a lot of bad side effects with our residents, that also goes a long way. Let's see, what strategies?
Sue, as you're talking, actually just on the last question, the last statement in regards to letting the residents know about how there's been such a low rate of side effects. How do you do that? How is that communication brought to the residents and the family members? Because that's a good encouragement for someone that's like, look, no one got any bad side effects. You should do this.
Well, usually we do have a COVID board. We have a bulletin board that's right inside the front door, and we put the most recent information about the COVID vaccine or the boosters or whatever comes out that is new to the public. We put that on that board. But also, every time we have a vaccine clinic, we personally contact the people that have not been vaccinated. And so when we contact them, when we're giving them information about the vaccine, that's when we slip in the fact that there haven't been, they'll say, well, have you had any people with bad side effects? Have you had anybody hospitalized because they had the vaccine? And that kind of thing. And that's where we can tell them that.
Okay.
Because we have to call them to get a refusal or a declination for every time we have a clinic, and show that we have offered it every time we have a clinic.
Okay. And Sue, the other question I have is going back on your comment in regards to informal leadership. I call them vaccine champions, those that we want to spread the word, right, about getting vaccinated. But as a leader, so as the DON, did you just go and say, hey, I see that, you got vaccinated, could you spread the word? Or what did you do to get those people on board for that effort? Was it easy to do? Did you sit down with them? Did you say anything about what you wanted them to do for you? How did that look? What did that look like?
Well, I actually kind of noticed that she was doing it on her own. And then I went to her and I thanked her. And I said, if there's anybody else that that is kind of on the fence about the vaccination, I would really appreciate if you could talk to them and let them know that you got the vaccination and that you think it's a good thing to do. And that's basically what she did. So I noticed that there were some people coming to get vaccinated that at the beginning were really hardcore, I'm never going to get this vaccination, and how do they know, and I don't want to be experimented on, all the comments you hear. And then all of a sudden they were coming to the clinic. And I thought, that's interesting. And then I noticed her, telling them, oh, did you get your vaccination? They said, yep, I got it. And I thought, okay, well, obviously she has influence in them getting it. So it's just really keeping your eyes open for who you already have in your building who is already being a champion. It seemed like there were people that just automatically stepped up and became champions. And then also using your department heads and the people that are in your formal structure, and especially, people that have been vaccinated for sure, and having people understand that, look, I got mine, and I do that with the flu vaccine every year. I get my flu vaccine because I can't really expect anybody else to get a flu vaccine if I'm not taking it myself, and I don't have any reason not to. I don't have any medical issue not to take it. So I take it just for that reason, as much as anything, just to show that I'm taking it, so it's an okay thing to do. And it's the same with the COVID. So the more of your leadership that you have vaccinated and that also talks about it as a positive thing also helps.
Yeah, I agree. I might be flip-flopping a little bit here, Sue, but you mentioned about a communication board that you use for COVID. I've worked with communication boards in the past and felt that at times people did not always read them or seem responsive to a communication board. Do you have any tips on how to keep that communication open when you're posting things?
Well, it has to be up to date. I know we talked about it when we were preparing for the presentation. If you put a poster board up and it's got the same thing on it for a year, nobody's ever going to look at it because it's already been up for a year. They know that that's not really current information. If you are constantly changing it and every week or so you're putting something new up and taking something else down, and I don't go crazy. I put things up that are put out by the CDC, that are put out by you guys. I mean, any things that are put up that I think would be interesting to either the staff or the residents' families and the residents, and then kind of move things around on the board a little bit. And there's some sparkly things, and there's some colorful papers, and there's some graphs about vaccination rates versus rates of transmission and that kind of stuff. So if they want to see something more scientific, it's there. But I don't only put that kind of thing up. I also put up some funny things. There were some funny things about some cartoons that were put out at one time about vaccinations, I think it was. Or maybe it wasn't vaccinations. It was something about the changes in the community because of COVID. It was about wearing masks and about being 6 feet apart and that kind of thing. And there were some funny little cartoons. I put them kind of around the outside so they could have something else to look at besides just the raw data. And I don't really spend a whole lot of time on it. It's usually stuff that I'm already printing out for either staff education or for a presentation or something I printed out because I wanted to show my family, you know, and I just make a copy and put it up on the board. And I know people say, oh, nobody will, if it's just posted, nobody will look at it. They'll look at it if they get used to it and they get used to the fact that that's where they're going to find new and useful information. My door is another place. I put it on the DON office door. If I put a flyer up on my door, people read it because my door doesn't usually have anything on it. So if I put a flyer up on it, that means there must be something new and different that they need to take a look at.
Great, thank you. Sue, before I did stop you, was there any other strategies that I may have cut you off on in regards to strategies that were effective for vaccination for either the staff or residents that you wanted to mention? And if not, that's fine. We'll go on to the next question.
There was one other thing. You know, we talk about residents and staff getting staff to get vaccinations and that kind of thing. But actually, sometimes residents can also influence things. If you have residents that are also kind of like the resident council president or people that always are trying to get bingo to, you know, more bingo sessions. You know, the people that are kind of pushing the activities department to do certain things. Those are kind of your informal leaders of your resident group. And I have had families and residents talking in activities about the vaccination and people that aren't vaccinated talking to people that are. And so that's another informal use of an activity or a resident council that you can use and remind them about, you know, that this is available to anybody who hasn't had the vaccination. And if you'd like to have it, let your nurse know. So besides using it with staff, you can also use it with the residents. And it came up a little bit more recently because we're getting more groups of people together more, you know, socially distanced and masks and different things depending on their vaccination status, but still they're getting together more. And I see the visitors and the residents talking more to each other than it was when everybody was just in their room. So we may as well use that group setting also as another way to get more people vaccinated.
Great. Sue, the last question I have here on this slide is in regards to workplace culture and how workplace culture plays into your COVID vaccination process. Do you see that a positive workplace culture has enhanced vaccination uptake? And if so, what do you do to promote positive culture in your building?
Well, I talked about a couple of them, which is, you know, that leadership is participating in the vaccination. But the other thing is, when we have a vaccination clinic, like the first time we had a clinic, we made it kind of a thing where they came, they got a sucker after they got their vaccination, and they got a Superman Band-Aid on their vaccination site, and it was almost like an event versus just a vaccination clinic. That helped at the very beginning to get quite a few people vaccinated, I think, because people wanted to participate in that activity. So, yep, they got their vaccine. Making it easy for people to get it, it's not something that's very difficult to do. You know, there's a certain date and a certain hour spreads when they can come and get their vaccine, and it doesn't have to be any harder than that. But as far as the culture itself, I think really just talking about it in a positive way. You know, if somebody has had a reaction to the vaccine and they walk all over the building and talk to everybody about how horribly ill they were for weeks and weeks and on and on and on, and it goes on too much, then it could be a problem. So you have to kind of counter that with all of the people. Okay, that's one person, but these other 9 people got that vaccine the same day and didn't have any reaction at all. You know, and so try to have people understand that, yes, there are sometimes reactions to different things happen, but the great majority of them had a positive outcome. And you have to constantly be on the lookout for that, because you don't always know that it's happening until maybe you hear it in a meeting or you hear it across the hall, if you're across the hall from a dining room or something, and just trying to constantly give the positive spin on whatever the negativity has been. It's not easy. I mean, you know, buildings, you know that something you don't want anybody to know gets around the building a lot quicker than something you're trying to teach everybody. So you just have to kind of go with it. And just on a daily basis, just think to yourself, you know, we know that we haven't had very many people off ill. You know, we don't have any COVID in the building with our staff or with our residents, and we've had very few throughout the last 4 or 5 months. So I think that evidence right there, the evidence of the fact that since we have a fairly high vaccination rate, we are not having the outbreaks that some of the other buildings in the area are having. I think that's helped a lot too.
Perfect. Well, Sue, as time has been flying here, I realize now that we're at our last question, and I think this is the most important question of the day, I have to say, because if you could give another facility one piece of advice to help them increase their vaccination rates, what would it be?
I think it's to recruit your staff to become vaccine boosters. I put boosters in quotes, or vaccine champions. The one that I was talking about earlier, she's not a nurse, she's not a department head, she's an activity aide. And so you have to make sure that you're not only thinking about people that you consider leaders in their job, but also people that are leaders in their community. And so they don't have to be necessarily a department head or a nurse or a CNA even. They can be whatever is informally influential in your building. And so this particular lady is an activity aide who's been here for a lot of years. So I guess looking at some people who are long-time employees also helps, because I think a lot of them have the most influence. So I would just say recruiting your staff to become your vaccine boosters and not relying on only yourself or your department heads to try to talk people into taking the vaccine. That would be my biggest piece of advice.
Well, I think that is great advice, because I agree that if you want the staff to know something, go ask the person on the floor that they respect the most, because they'll tell you for sure.
That's right.
Yes. Sue, do you have any other comments that you'd like to add, or are there any questions? If there's anything you'd like to add, go for it, Sue. If not, we can open it up to questions. I haven't looked in chat to see if there's anything, but if anyone has anything they'd like to ask Sue, please feel free to either unmute yourself or put the question in chat.
Well, I did attend the ECHO sessions when they first came out. The ones that were, the group that I was in was actually from New Mexico. And that was helpful at the time, because it was at the time when everybody was kind of feeling isolated from each other. So that helped a lot. So I think the more things we have where people are talking to each other and getting ideas from each other, the better. Because, as I mentioned to you, the state was here the last 2 days in my building. And, when that's going on, you feel like you feel like a fish out of water, like you're the only one. So it's really nice to talk to other people who are going through the same types of things and maybe have a different view or a different way of doing something and can give you a fresh idea. Because after 2 years and a month now, it's having fresh ideas is not easy anymore. The fresh ideas have kind of all become kind of stale. So I think that's something that I really appreciate about your group, is that's kind of what you're doing, is bringing us all together for that. Because we have groups within our own companies, but there's a lot of different companies, and different people have different ideas of how to handle different situations. So I thank you for that too. Thank you
too. Thank you, Sue. We appreciate that. We didn't even ask you to do that.
I have to.
Anyway, Sue, we do have a comment in chat, and it's from Tony, and this person states, unfortunately, with Omicron, we've had outbreaks, and this last one had more vaccinated staff than unvaccinated, even those boosted. So many of us had a different experience. At this time, CDC's requiring unboosted staff to test as those unvaccinated. That has been a big pushback. We also have a big pushback from the group that followed many of the other theories about the vaccine. 70% vaccinated is what they have. It's not I hear the story. Do you still get some of this kind of talk in your home in regards to, well, why should I get this? I mean, people are getting the virus anyway, whether I'm boosted or not.
Yeah, but they get less sick. And so that's what I tell them. I said, it's just like anything. Vaccines are not meant to 100% take care of you never getting just like the flu vaccine. So if it's only 20% effective, that's still 20%, not 0%. And the same with the COVID vaccine. Even though we're getting outbreaks, there's a lot fewer severe cases. I've had 3 people in my family that have had COVID since they were boosted. But all of them had much more minor symptoms. And so that's kind of what I tell them, is that this is not meant to be a cure-all. It's not going to be an end-all thing where you're going to just not ever get a fever, or you're never going to lose your taste or smell, you're never going to get a cold. I mean, that's not what it's going to be. But the chances of you being hospitalized, et cetera, are still a lot lower. And so I just keep going back to that. That's
a very good response. Do they ever does any of your staff ask you for, like, where do you get that information from? Or do they not, are they just like listen to you, or are there people that want the proof?
Well, they all Google everything. So they all go online and see the different information and the different stuff from the CDC, and you can go on the different county websites and everything. So a lot of times they've already gone on that. I just steer them away from social media where people are giving their opinions versus the actual numbers, because there are a lot of opinions out there based on, nothing. So I do try to tell them that, you need to look at somebody or an agency that is trustworthy. The lady at your church may or may not be, unless she works for the CDC, I guess. But you have to think to yourself, is this somebody who really would know that before you would listen to their information?
Well, we have about 1 minute left in this, again, short half-hour session. I don't see any questions. I do see, though, that we have the survey is here in chat. So please, if you could take a minute to just click on that and put in your evaluation, we greatly appreciate that. Sue, I just cannot believe you were here for this. This is great that you wanted to talk to your peers about vaccination and your facility and how you've been conquering this beast We really appreciate it, and we were just so happy to have you.
Yep, Kim, I was just going to mention to Kim and Sue, Angie just put a comment in chat.
Oh, sorry.
She took a look at her staff, and what I'm just going to get quickly to the gist of it here. And Angie, if I get to the gist wrong, please let me know. She saw a little difference in staff that were vaccinated and those that were not, but there was a significant difference for those that were up to date or had been boosted. And Angie, if I sum that up too quickly, just let me know. But so I thought that was
we're going to have a vaccine clinic coming up this next week, and our biggest push is going to be for the booster, because we have a lot of people that are vaccinated but not totally up to date with their booster. Exactly.
Perfect. Just what we've been preaching. Yes.
Mm-hmm.
All right. Thank you for putting that in there, Jerry. I'm sorry that I missed that comment, Angie. I apologize for that. I was not trying to cut you off, so we got it in there. All right. So that's the end of today's session. Next week. Oh my gosh, I can't remember what next week is. Yes, I got it right here. A family perspective about separation during COVID. Our speaker is going to share her story about her loved one with dementia and how they fared through the height of the pandemic. Things that worked, things that didn't work, lessons learned. So that's next week. And I hope that all of you will be there for this great discussion. Thank you again, and have a great afternoon. And thank you, Sue.
Thanks, Kim.